Hello and welcome to the late night edition with me, Ayushman Singh Jamwal. Ladies and gentlemen, breaking news coming in at the top of the bulletin. Amid the protests over the Kolkata rape and murder, the Indian Medical Association has now written to the Union Health Minister JP Nadda demanding safety of doctors and directions to the Bengal government to ensure justice. The IMA has given 2 days ultimatum to the health minister to fulfill the demands, which include declaring all hospitals as safe zones and establishing police camps in government and private hospitals to ensure the safety of doctors. That has become the crux of the national push in the wake of this shocking incident coming in from Kolkata. To get more details, I'm joined by my colleague Sharon Elizabeth on the broadcast. Sharon, give us the details, and what is the 2-day ultimatum mean when it comes to this pitch from the IMA?
Well, amid the nationwide strike that has been called by the resident doctors, the IMA, the Indian Medical Association, has also written to the Union Health Minister over the demand of safety of doctors and the kind of steps that needs to be taken when it comes to the incident that has happened in West Bengal. Now, the demands are, of course, that the hospitals across the country should be declared as safe zones. Law should be defined the ultimate entitlement of the terms safe zone. All major government hospitals should have police camps and adequate security. Similar security arrangements should be made mandatory in large private hospitals. CCTV cameras in vulnerable points should be made compulsory. Apart from that, when it comes to the West Bengal incident, the IMA has in fact demanded that an impartial, thorough investigation of the case and punishment of the culprits, a detailed inquiry into the condition and enabling the crime, urgent steps to improve the safety of the doctors, especially the women in workplace, is something that has been demanded. Now, the ultimatum is of 2 days. What the IMA in their press release has mentioned is that if these demands are not met, then they will further have a discussion with the stakeholders and will, in consultation with their state branch, will take further action in this regard. So they have submitted a memorandum. We have to, of course, see what is going to be the response when it comes to these demands that have been made by the IMA as far as the health ministry is concerned.
Absolutely. Doctors across the country refusing to back down. Thank you, Sharon, for joining us on the broadcast with that piece of breaking news. Now let's listen in to the president of the Federation of Resident Doctors Association on what he had to say when it comes to the reaction from the medical fraternity in the wake of this gruesome crime from Kolkata.
We've seen these protests in the past. We've seen these strikes by resident doctors. We have heard their anguish. We've heard their grievances. And yet, repeated acts of violence are committed on doctors. So what is the guarantee to these resident doctors that this time around things will improve?
See, there is, we are not fighting for a guarantee from the government regarding such incidents not occurring in the future. What we are fighting for is that, I can assure you that there is a guarantee that if no actions are taken this time, this is going to get more severe. I can guarantee you this is going to get more violent, and this is going to get even more gruesome. So, but in my tenure, this is the first time that we are protesting like this. Incidents have happened. We have always tried to, seek the route of dialogue and discussions with the officials and administrators. But this time, the, watermark has gone a little too far for us. And therefore, we want that the act should be implemented, or it should be in the process of implementation now, besides the regular set of demands that we have addressed in our letter. Because, if at all there is to be a deterrence for the public, for people trying to enter into the hospital premises and threatening or hurting the doctors.
True.
It has to come from a central level. It has to come from a union level. And therefore, there should be some provision which protects the doctors under one law.
And about this case that has happened in West Bengal, what are some of the main demands? What is the ask by the Federation of the Resident Doctors Association? And other than the enforcement of the Central Protection Act, the other big demands that you're putting forth to the government?
So what we are saying, to the officials and the government in our letters of communication is that, we primarily, the epicenter of this strike is Arjikar Medical Institute. So we want that all the demands that have been released in their press meet only last evening, I think you have it with you, they should be addressed. They are demanding a CBI inquiry. They are demanding an unbiased inquiry through a national agency. They are demanding compensation for the victim and, victim's family. It hasn't been announced yet. They're demanding, some administrative changes in their hospital, resignations of some administrators. Last night only, I think the the Bengal police has transferred a higher official who was in charge of the outpost of that medical college. So the demands are being addressed in a sequential manner, but not wholly. And apart from this, I think they have their local security issues which they want the security measures to be beefed up. But apart from this, our demands, in addition to RG of course, is the compensation and CBI inquiry in their case, because a lot of dirt is being played around. There are many allegations of an inside job.